Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about Medical Records Management 101. Have you ever had a claim denied because a provider forgot to sign the notes? Or worse, you found out a patient's documentation was sent to the wrong patient? These are things that should be easy to avoid, and we are going to talk about that today in this video. We're going to talk about how to try and avoid costly mistakes, understand the privacy rule of HIPAA, get an idea of what you could keep, what you can toss, and when it's appropriate, but again, you would want to check HIPAA and other regulatory guidelines, and how to get tools to keep you efficient in this process. So why does medical records management matter in a practice? And you're probably going, duh, of course it matters. We have HIPAA and blah, blah, blah. And yes, of course. But medical records aren't just administrative work. They are legal documents and they reflect patient care. So they're not just used for healthcare reasons, they're actually legal documents, and people forget about that very easily. Being disorganized with your medical records, being inaccurate can cause a lot of problems. It can delay care and lead to clinical issues. It can cause claim denials, I've seen that a lot, and it can result in legal liability and audits or lawsuits. And you don't want any of that. One of the biggest things that has stuck with me since I've worked in healthcare over 20 years is the saying, if it's not documented, it didn't happen. And it's amazing how this is still not drilled into people's heads. It drilled into my head real quick. And I used to get criticized for over documenting when I worked in the assisted living, when I had to write up a report of an incident that happened or something like that. But I tell you what, I can't tell you how many times my thorough documentation with even the most insignificant detail, or what people thought were an insignificant detail that I documented, came in handy after the fact. They would have a question about something and I would say, look at my note, I'm sure I wrote it down, and sure enough, it was there, and it helped fill in a piece of the puzzle or answer something to be able to treat a patient more effectively, or how to train someone better, or even discipline someone, unfortunately. But it does come in handy. So yes, if it's not documented, it didn't happen, but you need to have thorough documentation. There are some things that people still don't understand about documentation in healthcare. We have PHI and we have PII. The PHI is protected health information. There are data points and pieces of patient's information and health background and history that is specifically designated as PHI. So diagnoses, medications, treatment plans, things like that are considered PHI, and they follow under the HIPAA compliance regulatory guidelines. Then you also have PII, which is personal identifying information. And those are pieces of information like the patient's address, their phone number, their email address, their medical record number, things that you don't realize might not be sensitive information, like their medical record number, but it is. And there are like 21 different classifications of what is considered PHI and PII on the CMS website under their HIPAA regulatory guidelines. And honestly, I have that list pinned next to my desk because when I go to write an email or I'm going to try to attach something in an email, I see if anything that I am including in my communication is considered and classified as PHI or PII, and if it is, I encrypt that email because I do not want to put my company or myself at risk of violating that when I know I shouldn't be. And if I'm not sure, I go on the air of caution and I encrypt it anyway because it's not going to hurt anything. Other things that people don't realize that is PHI or PII are photos. dates of birth, and any kind of drawings, dermatologists might have like a body and marking things, and it might have the patient name and date of birth on it. Because of the information that's on there, it can make it a PHI or PII classification. You have to be careful because sometimes it's a little bit more complex than what meets the eye. HIPAA, or the Health Information Portability Accountability Act, is the regulatory body that tells us how we can use the PHI and PII, how we can store the PHI and PII, how we can communicate and send the PHI and PII to other entities, and exactly what's protected. One of the major pieces of HIPAA is that you only access PHI and PII on a need-to-know basis. That means if I work in a doctor's office and my friend sees one of the doctors and I just want to be nosy and see what they came in for, and I open their chart, even just to see their diagnosis, I maybe didn't even go to the progress note for a visit, I am violating HIPAA because I don't need to know. I am not involved in their care. I am not sending it somewhere where it needs to go, and I'm just being nosy. I'm just wanting to know what happened. That is a violation of HIPAA, and you cannot do that. Unfortunately, staff don't realize that is a HIPAA violation. And when you possibly have people who live in a small town and also work in a clinic in a small town, and a lot of people know one another, this is a high risk of people going in and violating the HIPAA and finding out information about certain people that maybe they should not. And there are ways in a lot of EMR systems to prevent staff from seeing things that they don't need to. And if they do get in there, they have to, quote, break the glass and give a reason why they're accessing it before it would be provided. And then it's monitored and logged and everything like that. But this is a major concern in a lot of areas where patients know an employee that also works at the clinic. There's also medical records that have a little bit additional compliance and regulatory information and steps that need to be followed. HIV, mental health, drug addiction, and rehab stuff. I'm probably missing something, but there's some more highly sensitive areas of healthcare that require even further careful handling of things. So if you're in a specialty that deals with any of that, then you want to make sure that you are aware of it, the regulations, compliance, and your staff is as well. Just be smart at handling PHI and PII. Like I said, if it's a physical paper document chart, you want to make sure things are put in locked areas. They're not left out in the open. Other people can't see the names and information. If it's walking away from a computer, that somebody locks their computer before they walk away so nobody can just walk up to their computer and see stuff. You want to make sure that if you're sending things electronically, that it's being encrypted, so you're using kind of like healthcare approved ways of doing so. You want to make sure you're using strong passwords and two-factor authentications to access EMR system, things like that. You want to make sure that your staff aren't sharing passwords and usernames to log into areas where there's PHI and PII. And you want to make sure that your staff understands that all of this, if there was a violation, needs to be reported internally so that it can be tracked and logged, because you have to report it as a healthcare entity. Although we have gone mostly electronic in healthcare, we still have practices that just use paper, which is totally fine. However, we're not fully electronic anywhere. There's still going to be paper somewhere. It's just the reality of the situation. Whether it's EOBs being mailed to you in checks because the insurance doesn't do electronic communication and interfacing. Maybe it's you have to print stuff to fax, or someone wants a copy of the printed documents. There are many different reasons why there could be PHI and PII on paper, but you have to be mindful of it. Your staff needs to be mindful of it and make sure that they're taking the right precautions to keep it safe. If you are only a paper practice, and that does happen, you have to make sure you have some kind of backup of everything, right? Unfortunately, there are requirements in the HIPAA security and privacy that requires certain levels of backup of information, even if it's paper. So you have to make sure that if it's paper, it's being scanned and archived, that it's backed up somewhere on a server, things like that. If you still have paper in your practice, like all paper charts, you would want to look into this further if you're not aware of it. Some people don't like to go to electronic medical records, health record systems, but there are a lot of pros to it. So I have a little list of converting to electronic, which again, most people are, but there are still quite a few that are not. It's easily searchable. It's so much easier than old school, and I've done it, paper charts, trying to go through each section and find what I'm looking for. It's so much easier electronically to search for what you're looking for. It reduces errors. It really, really does, because it's more simple and straightforward. It has audit trails. It tracks changes in a lot of parts that are required. It tracks edits. If somebody were to change a progress note or a result, you'd be able to see that, which is really important. It auto timestamps and provides digital signatures, which is also very helpful and quicker. But there are some cons to EHR. Not everything is perfect. So it does require training and updates and making sure that you're staying on top of all of that. It can be expensive, but those are pretty much, I would say, are the biggest cons. There's probably other ones out there, especially depending on your situation and your specialty, but those are the biggest ones that are probably going to affect everyone. You could find a hybrid system if you're scanning maybe paper into digital charts, or you could have like a digital scheduling system, but you still have paper documentation, things like that, and maybe slowly convert over to a fully electronic. It's up to you if you're still on paper, but those are just some things to think about. The management of medical records in electronic medical record systems is much easier. It is usually a little bit safer. And depending on your specialty and how thick charts can get, storage is a lot easier as well. Just a quick rundown of what should be in medical records. Of course, you should have patients' full legal names, the name that they go by as well, their dates of birth, their history and physicals, any SOAP notes or clinical notes, orders, labs, imaging, referrals, authorizations. You want medications and allergies. Let's see here, signed consent forms, any kind of questionnaires that they take, like a PHQ-9 or something like that. You want to make sure that any communication with patients is in the medical records, any portal messages, emails, missed appointments and cancellations should also be in their medical records, authorizations, like I said, and claims related information. So electronic medical records make this a lot easier to store, to access, to track. However, if you're still doing paper, you still have to follow the HIPAA guidelines that require certain things, and you want to make sure you're doing that. For retention of medical records and storage and destruction rules. So I have this, but again, I am not a certified HIPAA quality assurance person. I am not certified in compliance. So what I'm giving you is a guide. If you are concerned or you're not sure, you need to look these up yourself, or you need to talk to a healthcare attorney to make sure you're following the proper guidelines. Again, this is just guidelines and suggestions. This isn't for sure the information, okay? But adults, you have to keep records for at least 7 years after their last visit. And your state might have different guidelines than federal, and that's something to keep in mind as well. Or depending on the type of medicine, like workers' comp or motor vehicle, might have different regulations and requirements as well. Again, this is just guidelines. This isn't permanent information. So adults, it has to be after their last visit. For minors, you have to retain their records until they're age 21. So if you're a pediatric office, you have to keep it till they're 21. Or if they see you after they're coming of age, of becoming an adult. It's 7 years after the age of majority, and it does vary by state. So if you're family medicine and the patient was last seen when they were 19, you would need to keep that for 7 more years from their last visit when they were 19. You can't get rid of it because they were a minor. I hope that makes sense. But again, you would need to look this up yourself if you're concerned and you want to make sure you're following the guidelines. Medicare and Medicaid patients, you have to hold them for a minimum of 10 years. So if a patient ever had Medicaid or Medicare insurance and they saw you, it's a 10-year rule. So see, things can just vary. So you want to make sure you know what you're doing. Some storage tips. You want to use offsite storage with a signed BAA if it's a third-party vendor. So if you don't store stuff on site, you want to make sure, in my opinion, it is certified to store healthcare records, and you would need them to sign a BAA. And then you can do cloud-based backups as well if you have an EMR and EHR, but it has to be HIPAA compliant, and there are requirements for that. So you would want your IT specialist or your security specialist to make sure that they're looking at that before choosing a cloud-based backup. For destruction methods, for paper, it has to be cross-cut shredded, and it has to be by a professional disposal system. If you do that, it needs to provide a certification. So you could do your own cross-cut shredding and house, but if you hire a professional shredding service, they have to follow certain guidelines, and you need a certificate of destruction that you have to keep on file for that, just speaking from experience. And then if it's a digital destruction, they have to do a full data wipe, not just a deletion. And there is a difference. If you're in IT or you understand the tech stuff, you know that that's a difference as well. And you probably would want to go through a company who specializes in HIPAA electronic medical record destruction as well, and get a certificate of destruction when that happens. And you want to make sure, like I said, the documentation of destruction shows the date, how it was done, the authorized person, and I would even ask for details of how it was done, not just the method of like wiping or something. Like, it should be a little bit more detailed than that. Some common mistakes to avoid is sharing PHI without signed consent. Review HIPAA guidelines on what needs to be approved by patients with a signature versus what you can share with colleagues and professionals like insurance companies based off of what is being shared and why. You can't leave records unsecured, whether it's walking away from your computer unlocked or leaving pieces of paper on your desk. Those are huge violations that a lot of people don't pay attention to. Disorganized files, like making a generic name like scan1234 is the file name, and then it doesn't get put in the right place, and it could be put in the wrong place, and it could be a HIPAA violation. Missing or unsigned notes. Claims can be rejected if providers don't electronically sign. That's a huge thing. That's why you have to have a very rigid process of submitting claims after a provider electronically signs their records. That's best practice. And then over documenting irrelevant information. You want to stick to clinical relevance and don't include judgment language or speculative notes. And that's very, very important. It has to be very objective. And again, I got accused of over documenting, but I promise you it wasn't like the sky was purple today and the clouds were out and then we did this. Like, I didn't do that. I didn't tell a story, but I did include details that I thought were going to be significant that usually were. And sometimes people are not good at learning that, and you might have to help train staff to be appropriate with that. So some EMR features to take advantage of when it comes to medical record management are role-based access. Like, a lot of times you can create like front office roles, back office roles, and only give security settings in the EMR of the areas that they need to do their jobs and nothing else. That is very, very helpful. And it also has an automatic audit log to see like who's going in where, who's making changes to what, and that can come in super handy. It has come in handy for me, honestly, quite a few times. And then a lot of providers like the templated notes because it helps them be more thorough in their documentation. It helps them make sure that patient safety is not going to be a factor, or continuity of care information is getting to places when it needs to when medical records are sent. However, templates can cause an issue at the same time, so it's a balancing act, and we're not going to talk about that today. Maybe that will be a video topic for another day. But the templates do help for faster documentation and more consistent charting, and that's really good too. Again, there are some software companies out there that allow for HIPAA compliant document sharing electronically, but your EMR system should be able to help with like patient portal stuff. If you were to share documents to patients through the portal, it should all be HIPAA compliant. There is practice management software out there that is very useful if you had to, and there are cloud backup tools with HIPAA compliance software companies out there that you could look into if your EMR doesn't have that already. You want to make sure that you are doing a records audit on a weekly basis to make sure that your staff is following the right guidelines when they're sharing records outside of the practice, whether it's with other doctor's offices or with patients or lawyers or whatever it might be. And you want to make sure you're doing monthly backups and test your recovery drills, because those are some requirements in the HIPAA, and you don't want to be stuck if something were to happen with your electronic technology stuff and not be able to retrieve your patient data. That could pose a huge financial risk, but also an even bigger patient safety risk. So you want to make sure all that's in place, and if you had to obtain it, it's easy to do, but you wouldn't know unless you test it. So just some final checklists to keep in mind. You want to make sure that your medical records are complete and legible. That includes what the providers are documenting, your staff are documenting as well. The access is restricted and secure. Backups are in place to retrieve if you needed to. Staff are trained on a privacy, HIPAA basics, but also doing their yearly compliance training. And that your destruction policies and how you go about it in your practice is documented, and you can back it up with how it's practiced. If you have any questions about medical record management, documentation, things like that, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. Thank you so much. I appreciate the support. Bye-bye.